If you have marked the answer for this question as option B, benzoyl peroxide, then your preparation is awesome and you are ready and you are prepared, well prepared for the integrated questions which can be expected in the upcoming NEET exam. So before explaining about this particular question, let me briefly tell you what is the treatment for acne depending upon the grade which you are dealing with. So acne, as you all know, it is divided into 4 grades depending upon the type of lesions which are seen. So if there are comedones which are predominant lesions, then we call it as grade 1 acne, and I hope you all remember that comedones are special lesions which are seen only in acne vulgaris. Comedones are absent in rosacea. This is one question which can be asked. And in the comedonal acne, that is grade 1 acne, the treatment is going to be topical retinoids. Topical retinoids, Adapalene is more preferred over Tretinoin. Whereas in the grade 2 there will be papules along with the topical retinoids. We are also going to add topical antibiotics in this case, topical antibiotics. And in the case of grade 3 acne, there will be pustular lesions predominantly, and here topical retinoids are going to be continued, but instead of topical antibiotics we are going to add oral antibiotics. And now comes the fourth grade of the acne, where the nodulocystic lesions that will be present, and this is in fact the most severe form of acne vulgaris. Here the treatment which you are going to give is oral isotretinoin. So I hope all of you know until this point, but there is a small catch in this MCQ which is asked. So she is 28-year-old married woman who is 3 months pregnant, and she is having some comedonal acne, and we have to give her some treatment. And please remember, retinoids, whether they are oral or topical, they are highly teratogenic. They are highly teratogenic. Okay, so yes, she has comedonal acne in this MCQ, but because the even topical retinoid, which is adapalene gel, is also teratogenic, so we have to avoid this. And yes, then option C is again telling a combination of A and B, and estrogen does not have any role whatsoever in acne treatment. So our best choice is going to be benzoyl peroxide in this case, which is first line topical agent in grade 1 acne in the case of women of childbearing potential or women who are already pregnant. Okay, this is a safer alternative for topical retinoids. This is a very important MCQ with integration of dermatology, and also we can see gynecology and pharmacology. So these kind of MCQs can be most expected in the upcoming NEET. So be well prepared. Write down 407 followed by your